Turning now to your community focus. On a beautiful day like today, you probably want to get outside, but health officials want to make sure that you're enjoying the sunshine safely this season. Joining us live now in studio to talk about that is Dr. Carla with the Department of Health. Thanks for being here.
Thank you.
So most of us know, of course, staying out in the sun too long can cause sunburn and other problems. What is your advice for people as we head towards summertime?
Yeah, so the UV rays of the sun are strongest between 10 a.m. and 4 p.m. So if you're going to be out during those hours, definitely apply a broad spectrum sunscreen. So we recommend an SPF or sun protection factor of 30 or higher. Apply it to all areas that are exposed to the sun. Apply it every 2 hours or so. If you sweat a lot or if you're swimming, definitely apply it more frequently. So that's one sort of thing that everyone should do. Try to find shade, use a hat, a broad-rimmed hat, and sunglasses that have UV protection as well is recommended.
And I know on the topic of sunscreen, you know, there are some with different ingredients. Obviously, the strengths are different. So you're saying at least a certain amount people should look out for.
So minimum of 30. Most dermatologists recommend a mineral-based sunscreen. So it does get a little bit confusing, but definitely one with 30 and up. And another caveat is if you have a baby who is 6 months or under, we do not recommend putting sunblock on them. So we're really trying to keep them in the shade, long sleeves, to keep them safe.
And skin cancer is one of the most common, if not the most common type of cancer, often linked to too much time in the sun. What should people look out for, you know, on their own skin?
So if you see a mole that's changed in color, size, or shape, that's concerning. That should be checked out. Or something new. If you've had a sunburn, if you have a family history of skin cancer, if you're out in the sun a lot, or if you use tanning beds. Tanning beds really increase your risk of melanoma, which is, you know, the serious form of skin cancer. You know, definitely be more on the lookout. If you have a lot of moles, also you can see a dermatologist once a year, and they'll do a scan of your skin every year.
Certainly important things to keep in mind as we head toward the summertime. Any other advice for people as we go toward the summer months?
People who have darker skin often feel like they're not at risk, but actually they are at risk of skin cancer, and often it's found at later stages, which makes it harder to treat. So please, if you have darker skin, all people should be wearing sunscreen and taking the same precautions.
Important advice this time of year. All right, Dr. Carla with the Department of Health. Thanks for being here.
Thank you.